Today we are looking at one of the most powerful peptide stacks for weight loss, retatrutide plus Mots-C. One is a heavy-hitting fat loss agent, the other is a mitochondrial optimizer that protects energy and muscle during a cut. Together, they are one of the most talked about combinations in modern body recomposition. Retatrutide is a triple agonist. It activates GLP-1, GIP, and glucagon receptors. That means powerful appetite suppression, big shifts in metabolism, and serious fat loss. Clinical trials have shown up to 24 to 28% body weight reduction at higher doses. It is currently the most potent GLP-based compound in human research. Mots-C is a 16 amino acid peptide encoded inside mitochondrial DNA. It activates the AMPK pathway, improves mitochondrial efficiency, boosts fatty acid oxidation, and increases insulin sensitivity. In a calorie deficit, it helps preserve energy and protects against muscle loss. Why stack them? Retatrutide creates the calorie deficit through appetite control. Mots-C makes sure your body still has the energy to function, train, and burn fat efficiently during that deficit. Retatrutide drives the loss. Mots-C protects the engine. That is the whole logic behind this combo. Before any dosing, the rules. Always work with a physician. Get baseline blood work. Retatrutide is not yet FDA approved for general weight loss, although approval is expected in the 2026 to 2027 window. Blood work should include glucose, A1C, lipids, hormones, and liver and kidney panels. Monitor heart rate. Retatrutide can raise it temporarily. Retatrutide titration. Always start low. Once weekly. Same day. Same time. Reconstitute a 10 mg vial with 1 ml of bacteriostatic water, giving a clean concentration of 0.1 mg per unit. Weeks 1 through 4, 1 to 2 mg. Weeks 5 through 8, 4 mg. Weeks 9 through 12, 8 mg. Week 13 and beyond, 8 to 12 mg as maintenance. A few notes on retatrutide. Start at the lowest dose your protocol allows. Even half a milligram is fine if you are sensitive to GLP drugs. Titrate slowly to minimize nausea and gastrointestinal side effects. Subcutaneous injection. Rotate between abdomen and thigh. Refrigerate after reconstitution. Mots-C protocol. Reconstitute a 10 mg vial with 2 ml of bacteriostatic water, giving 5 mg per milliliter. The reference protocol calls for 5 mg, 2 times per week. In practice, many users run a more conservative dose of 15 to 20 units, around 0.75 to 1 mg, 3 times per week, which is gentler and stretches the vial further. When to add Mots-C to the stack? Do not start them both on the same day. Begin retatrutide first, and let your body adjust through the first month. Around week 5, once tolerance is established, layer Mots-C on top. Run Mots-C for 8 to 12 weeks, then assess. The peptides are not magic. They work when paired with the basics. Calorie deficit of around 500 calories per day. High protein, 1.8 to 2.2 grams per kilogram of body weight. Resistance training 3 to 4 times per week to protect muscle, plus cardio for additional output. Hydration and electrolytes matter, especially with GLP side effects. Optional synergies, only under medical supervision. AOD 9604 supports targeted fat breakdown. Tesamorelin helps with visceral fat and growth hormone support. BPC 157 assists gut and joint recovery, which is helpful during heavy training. L-carnitine or NAD+ can add additional mitochondrial support on top of Mots-C. Expected results: 15 to 28% body weight loss over 6 to 12 months with adherence. Stronger appetite suppression and less food noise than dual agonist drugs. Better energy and endurance than retatrutide alone, thanks to Mots-C protecting mitochondrial output. Improved insulin sensitivity and better body composition overall. Risks and side effects: gastrointestinal upset, including nausea and diarrhea, dose-dependent and usually milder with slow titration. Possible temporary heart rate increase. Injection site reactions. Some users feel fatigue or glucose shifts in the first week of Mots-C, especially if sedentary. Muscle preservation absolutely requires training plus adequate protein. Long-term combination data is still limited. Summary: retatrutide drives the fat loss. Mots-C protects the energy and muscle. Together, they are one of the most powerful body recomposition stacks currently available in peptide research. Start retatrutide first. Titrate slow, add Mots-C at week 5, and pair the whole thing with smart training and nutrition. Standard disclaimer. This is for research and education only, not a drug, not for human consumption. Always consult a licensed medical professional before starting any peptide protocol. Stay curious, stay safe, and we will see you in the next one.